If your hands or feet feel like they're being stabbed by thousands of tiny needles, stop what you're doing and listen closely. What I'm about to share helped a 67-year-old patient of mine regain sensation in her fingers in just 14 days using something she already had sitting in her medicine cabinet. I'm Dr. Ryan Mitchell, and for years I've worked with adults over 60 struggling with nerve damage. What truly breaks my heart is this. Most people living with tingling, numbness, or that relentless burning in their hands and feet have no idea there's a simple solution, one that can begin working in as little as 2 weeks. Today, I'm going to show you exactly which B vitamin your nerves are desperate for, why it works when so many treatments fail, how much to take, and the one critical mistake most seniors make that silently blocks results. Before we go any further, drop a comment right now. Do you experience tingling, numbness, or burning in your hands or feet? How long have you been dealing with it? I read every comment, and your experience helps me create better content for you. Now check in with your body. Do your hands or feet tingle when you lie down at night? Do you struggle to feel hot or cold water? Are buttons harder to fasten than they used to be? Do you ever feel unsteady when walking? Or maybe there's a burning sensation that never fully goes away. If you answered yes to even one of these, your nerves are sending out a distress signal. And here's what most people are never told. This isn't just about discomfort. Left untreated, nerve damage can progress to permanent loss of sensation, a higher risk of falls, and a rapid decline in independence and quality of life. But stay with me because the real cause is simpler than you've been led to believe. Let me explain what's happening inside your body right now. Your nerves function like electrical wires running from your brain to every part of your body. Your fingers, your toes, everywhere. To work properly, those wires need insulation, a protective coating, much like the plastic layer around an electrical cord. As we age, especially after 60, our ability to maintain that protective nerve coating drops sharply. When it begins to break down, nerves become exposed. Signals misfire. That's when tingling, numbness, and burning pain appear. Here's the part most doctors never connect. There is one specific B vitamin your body must have to repair and maintain that protective coating. Without it, nerves cannot heal. With it, damage can be reversed. I'm talking about vitamin B1, also known as the mine. And before you dismiss this as just another supplement trend, let me share something with you. In my practice, I've seen people who couldn't hold a coffee cup without dropping it regain full strength in their hands. I've watched patients who felt disconnected from their feet become steady and confident again. This isn't magic. It's biology. It's simply giving your nervous system what it's been missing. Think of it this way. If you owned a car and never put oil in the engine, eventually it would grind itself apart. Vitamin B1 works the same way for your nervous system. It acts like oil for your nerve pathways. It protects the wiring. It keeps communication flowing smoothly from your brain to your hands, your feet, and every muscle in between. When B1 levels drop too low, it's like running your nervous system on empty. Signals become distorted. Messages misfire. That's when the pins and needles sensation starts. Your hands feel numb. Your feet feel disconnected. Walking becomes frightening because you can't feel where you're stepping. But when the body finally receives the B1 it needs, something remarkable happens. The repair process begins. The protective coating around the nerves starts rebuilding. Signals travel clearly again. Numbness eases. Sensation returns gradually like a dim light slowly coming back on. Now, you might be thinking, Dr. Carter, I've heard about B vitamins. I eat well, I probably get enough. That assumption is where most people go wrong. The reality is a shocking number of adults over 60 are deficient in vitamin B1, and most have no idea. Research shows that up to 1/3 of older adults don't get enough B1 from food alone. And those numbers climb even higher if you're taking certain medications. Why does this happen? There are 3 reasons almost no one explains. First, aging changes digestion. As we get older, the stomach produces less acid. Less acid means poorer absorption of B1 from food. Even when you're eating the right foods, your body may only absorb a fraction of what's there. A healthy 30-year-old might absorb 60 to 70% of dietary B1. After 60, that number can drop to 20 or 30%. Same meals, same nutrients, completely different outcome. Second, many commonly prescribed medications actively drain B1 from the body. Diabetes drugs, especially metformin and certain water pills used for blood pressure, can dramatically reduce B1 levels over time. Some heartburn medications do the exact same thing. They solve one problem while quietly creating another. I've seen patients stay on these medications for 10 or even 15 years without a single doctor ever checking their B1 levels. Over time, nerve damage slowly develops, and everyone shrugs it off as just aging. But it's not aging. It's a vitamin deficiency, one that could have been corrected early and easily. Third, even if you're eating foods rich in B1, whole grains, beans, lean pork, you may still be absorbing only a small fraction of what your body needs. The digestive system simply isn't as efficient as it once was. On top of that, modern food processing strips B1 out of many staples. White bread, white rice, highly processed foods. They look filling, but nutritionally, they're almost empty of B1. Let me give you a real example. I had a patient who was 71 years old and extremely health conscious. He walked every day, ate plenty of vegetables, avoided junk food, yet the numbness in his feet was getting worse. He said it felt like he was walking on thick socks all the time. He couldn't feel the pedals when driving. We ran his blood work. His vitamin B1 levels were dangerously low. When I reviewed his medications, the answer became clear. He'd been taking a diabetes medication and a water pill for years. Those drugs had been quietly draining his B1 reserves the entire time. We started B1 immediately. 3 weeks later, he called me almost in tears. He said, "Dr. Carter, I can feel my feet again. I can feel the ground when I walk. I can feel the gas pedal in my car." He felt stable, confident, safe. That moment changed how I see this problem because it made me realize how many people are suffering needlessly. How many adults are living with low B1, developing nerve damage while no one connects the dots. If you're over 60 and experiencing tingling, numbness, burning, weakness, or loss of balance, you need to have your B1 levels checked. Every day your body runs low on B1, your nerves continue to suffer damage. And the longer that damage goes on, the harder it becomes to reverse. Now, listen carefully because this part matters. Here's exactly what you need to do. Step 1. Choose the right form of vitamin B1. Not all B1 supplements are the same. This is critical. You need a specific form called benotamine. That's the form your body can use immediately without extra work. Regular thymine often gets broken down quickly in the stomach before it ever reaches your nerves. Benotamine stays in your system longer, penetrates nerve tissue more effectively, and works far better for nerve repair. When you're shopping online or in a store, pick up the bottle and read the label carefully. Look for the word benotium spelled B-E-N-F-O-T-I-A-M-I-N-E. If the label only says thymine without specifying the form, it can still help, but benotium is significantly more powerful for nerve regeneration. Step 2. Get the dose right. For nerve repair, I recommend 150 to 300 milligrams of benotamine per day. That's the therapeutic range shown to support damaged nerves. Here's the reassuring part. Vitamin B1 is water-soluble. Your body uses what it needs and safely eliminates the rest. There has never been a documented case of B1 overdose. If your symptoms are severe, start at 300 milligrams. If they're mild, 150 may be enough. But most adults over 60 with active nerve symptoms need the full 300 milligrams to see meaningful improvement. Step 3. Use the right delivery method. Always take it with a meal that includes a little fat, such as eggs, avocado, olive oil, or nuts. Fat dramatically improves absorption. Never take it on an empty stomach. You'll absorb far less than you should. Step 4. Timing and consistency. Take your B1 every morning with breakfast. B1 supports energy production, so morning dosing works best. Taken at night, it may interfere with sleep. Put the bottle where you can't miss it, next to your coffee maker, your breakfast plate, or your toothbrush. Make it automatic. Set a reminder if you need to because consistency is everything. Your body uses B1 all day, every day. If you take it sporadically, you'll get sporadic results. Miss a few days and progress slows, or even reverses. Now, here's what most people actually notice when they take B1 correctly in the right form and dose. Week 1. Many people feel increased energy before nerve changes. Brain fog often lifts within days. Thinking feels clearer. Mornings feel easier. Some notice a calmer, more stable mood. Week 2. This is when early nerve signals often begin to return. Tingling may lessen. Hands may feel more responsive when you wake up. Feet may feel more connected when walking. These subtle shifts mean dormant nerves are reactivating and repair has begun. Weeks 3 and 4. The improvements become clearer and more consistent. That constant tingling begins to quiet down. You start noticing textures again when you touch things. Your balance feels steadier when you walk. You're not dropping objects as often. Moving around your home feels safer, more controlled, more confident. Months 2 and 3. This is where the changes become life-altering. By this point, most patients tell me they feel like a completely different person. The burning sensation is gone. The numbness is dramatically reduced or disappears entirely. They return to activities they had quietly given up. Let me tell you about Margaret, the 67-year-old patient I mentioned at the beginning. Margaret came into my office in tears. She told me she couldn't feel her grandchildren's hands when they held hers. She was constantly dropping things. She had fallen twice in 6 months. Her daughter had to come over every morning just to help her with buttons. Margaret had been a seamstress for over 40 years, and now she couldn't even button her own blouse. She felt embarrassed, frustrated, heartbroken. Her blood work showed severe vitamin B1 deficiency. We started her on 300 milligrams of Benodium daily right away. Within just 2 weeks, 14 days, she felt a difference. Her hands felt more alive, more present. Within 6 weeks, she was buttoning her own shirts again without help. By 3 months, she was back to knitting and sewing. Margaret suffered for 2 full years before she came to see me. 2 years of unnecessary struggle. She didn't have to endure that, and neither does anyone else. Now, before we go any further, there are 3 critical warnings you need to hear. Warning number 1, get proper testing before you start. Ask your doctor for blood work that includes vitamin B1 levels. This confirms whether you're actually deficient and gives you a clear baseline to track progress. Don't guess. Test first. Test. Warning. Number 2, some health conditions require supervision. If you have kidney disease or take multiple prescription medications, talk with your doctor before starting any supplement. For most people, B1 is extremely safe and well tolerated. But if you have serious medical conditions, medical guidance matters. Warning number 3, medication interactions are real. Diabetes medications and water pills are known to deplete B1. If you're taking them, your doctor should know you're supplementing so levels can be monitored and medications adjusted if needed. And there's one more crucial point most people never hear. Vitamin B1 works best when it's not alone. It functions as part of a team, especially with vitamins B6 and B12. These B vitamins support nerve repair together. That's why instead of taking B1 completely by itself, many people do better with a high-quality B-complex supplement that uses Benodium as the B1 source. When you look at the label, aim for a formula that includes at least 100 milligrams of B6 and 1,000 micrograms of B12. This combination is especially powerful for nerve health and delivers the strongest results in the shortest time. Now, here's your action plan. Write this down. Your 4-week nerve repair action plan. Week 1, get blood work done. Ask your doctor to check vitamin B1, B6, and B12 levels. At the same time, begin taking 150 to 300 milligrams of Benodium daily. Don't wait for test results. Start now. Week 2, add a high-quality B-complex supplement that includes B1 as benfotiamine, at least 100 mgs of B6, and 1,000 micrograms of B12. Take it every morning with breakfast. Weeks 2 through 4. Keep a simple symptom journal. Each day, rate tingling and numbness on a scale from 1 to 10. This makes progress visible and keeps you consistent. Week 4, follow up with your doctor. Review your vitamin levels and assess how your symptoms have changed. Bonus tips that make a real difference. Always take B1 with food. Avoid alcohol, which depletes B vitamins. Include B1-rich foods like whole grains, beans, and lean pork. Stay well hydrated. Aim for 6 to 8 glasses of water daily. This protocol has helped hundreds of my patients. It can help you too. If you found this information helpful, share it with someone you love who's over 60. It could truly change their life. Please leave a comment and let me know. Are you going to try Benodium? What questions do you have? I read every comment, and I'm here to help. Subscribe to my channel for more practical health tips designed specifically for seniors. Turn on notifications so you don't miss important updates like this. I'm Dr. Ryan Mitchell. Your best years don't have to be behind you. With the right knowledge and the right action, you can reclaim comfort, confidence, and independence. Thank you for watching, and I'll see you in the next video.